The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. So thrilled to have our guest on the program today. We know we've had our daughter on the program. It's a really cool story that we're going to have her share. But I want everyone to say hello to Dr. Kimberly Harms. Dr. Harms, say hello.
Hello, how are you?
Hey, I'm great. I'm grateful to have you here. Love it when dentists come on the program. Normally I would ask, how'd you get involved in dentistry? And I think that's probably a pretty good story. But in this case, I want to ask, your whole family's involved in dentistry, right? Mm-hmm. Your daughters are actually involved in dentistry. Your husband is a dentist. Kind of tell us about that dynamic a little bit and how that all came together.
Well, the story about how I got involved in dentistry really was back in the 1970s when I was going to college. There weren't very many women dentists at the time, but there was this really cute guy named Jim Harms, and he wanted to be a dentist. I was a zoology major, and I thought, maybe if I became a dentist too, he would marry me. And that is how I got there. I got into dentistry. I was following a guy. That is not the way to get into dentistry, but it worked for me. We worked together. We were married for 44 years. He passed away a couple of years ago, unfortunately, but we worked together for a long time. And as we were working together and our children got old enough, we would put them to work in the office as well. We were in a small town. So my whole family worked in our office. And all of them said, my two daughters especially said, there's no way we're going to become dentists, Mom and Dad, because of course our dream was that they would, take over our practice in the small town and we would have this wonderful family practice here. They became lawyers. And wouldn't you know that right about the time we were selling our practice and moving on, Hillary, my oldest daughter, took care of the transition. And she was at that time working in family law. And she took care of the transition and she said, Mom, you know what? I like doing this because it's kind of like family law, but there's no kids.
Right.
And so there were no kids to have to worry about. And she started her own business just 4 years ago in her home, doing exclusively dental law. And she has grown by leaps and bounds to a point where now she's expanding down into Missouri and Kansas. So it's been a great story because she knows dentistry. I think the main thing is she knows dentistry. She worked in dentistry. She knows dentistry. When she's working with transition, she knows what to look for.
Yep. She gets it, understands it. That's so valuable when it comes to choosing experts. Now, you work in the mediation side of things, and I know we're gonna record a couple episodes here, both of them at the same time, but one's going to air later than the other. We're going to talk about mediation here in a little bit, but I want to ask you first, and this is popular right now, it's buzz, but I think the more information that dentists have and office managers have, the better they can run their practices. Hiring, keeping teams together, right?
Yes.
Quiet quitting, for quiet hiring. There's all these new quiet terms that I have to keep looking up. Tell me, what are you seeing out there? What are some of the problems and challenges that you see practices and owners facing?
Sure. Well, quiet quitting is a phenomenon that I've never seen before, but it comes out after the COVID has changed things in so many ways. And it has kind of been translated, I think incorrectly in the United States many times as to, well, I'm just going to go to my job. As I sit at my job, I'm going to do just the basic minimum. And because I'm getting paid for this certain amount of work, I'm going to do the basic minimum. Now, when you take a look at how it got started in China, where many of the tech workers were working 76-hour weeks. They were working from 6 in the morning to 9 at night. They were working 76 hours a week, and they were burning out. And I think we can understand how you can burn out on that. I just was listening to an article about teachers in Japan who also were working 80 hours of overtime in a month. Again, burning out, too much work. Sometimes you're being asked to do too much work.
Yep.
And I understand that. So that I can see putting boundaries in place. But in the United States, I think we need to take a look at the importance of doing your very best while you're at work and setting boundaries. If you're a dentist, you need to make sure you have the boundaries set for your team. They should have a certain time limit from a certain time to a certain time. Of course, when emergencies happen, they happen, and we have to adjust to that. We're in the care field, but you have to make sure you're not taking advantage of that. But as an employee, when you're working together as a team, and as a team, you need to give your all for, when you're at the front desk
Sure.
and somebody needs help, we need to work together to give that wonderful service to our patients that come in. So you need to really give your all for that. And I think what we need to do is start to take a look in practices, rather than talking about quiet quitting, look at rebuilding our team so that everyone has that great feeling of working together. The patients get the best service possible. And really, when you work together and you give your all as a member of a team, you're a lot happier too. One of the things I'm concerned about as well, especially with the millennials who sometimes will advertise their quitting mechanisms, maybe on social media.
Sure.
We live right now, we're in an environment where we have a very low unemployment rate. When you have a low unemployment rate, you're going to keep your job probably a little easier than when you're a little more expendable with a high unemployment rate. And you have to remember that right now, you might have a little more control. You might be able to get away with a few more things that you might not be able to get away with in a normal setting. But at some point in time, that unemployment rate might go up to where it's harder to find a job. And you want to just make sure you don't ruin your chances at future happiness in a job by quietly quitting right now. And if you feel that you're being taken advantage of, talk to your dentist. And I think, dentists, we need to take a look at our team members to make sure that we have those boundaries in place. We're taking care of conflict, because that's one of the reasons people leave. Dentists many times feel that they don't want to take care of those emotional issues. And it's the emotional issues that drive people to and from jobs. So we have to really kind of take control of that. And we have to make sure we have a good place to work. And as team members, we need to work as a team and give everything we've got while we're there.
Sure. Yeah, it makes a lot of sense. So let's come to the quiet quitting under the definition of, somebody who, I'll tell you, one of the ways that I see the quiet quitting being used is when people are literally working for multiple jobs remotely, and all employers think they're working full-time exclusively for them, and they're literally working part-time or less for multiple employers. That's the thing that's happening right now. But it's like so much that happens today. It's on the far end of the spectrum, right? It probably shouldn't be thrown in there, but I think it is a pretty common place for someone to say, hey, I'm not getting paid to do this. I'm not getting paid enough to do this. I'm not going to do this because I don't feel like the tasks that you're asking me to do are worth the money that you're willing to pay me in return. And I personally have always had a struggle with this. And I think a lot of people do, because if you're getting paid by the hour, give your best hour, right? You're getting paid to exchange time. That's how I look at it. So what are some ways that you can get that employee who's a good person, like most people are, and who's has a knowledgeable employee that you don't want to lose, but literally has said to you, I don't get paid enough for this, or I'm not doing it because it's not my job, or what have you. How do you handle those situations?
I think it's really important to sit down with the person, discuss what the job is, what the expectations are. And not only that, but sit down with the team, because dentistry, we work together as a team. And sometimes we might be helping in one area, and we might see our team members struggle in the other area. And the way you build up a camaraderie, which really is a way to build happiness within a team, is that you help each other out. Part of the joy, I think dentistry is a joyful profession because we're helping people. Part of that joy is working together as a team to help each other. And if you're playing basketball, you're on a team of basketball, and someone's dribbling down the court and they miss a shot. You don't stop and point at them or turn around. You go to help them. You stay in the game no matter what's happening. And
Sure.
sometimes what I see in offices is we have kind of a blame game where people try to something's not happening. The ball drops at some point. Instead of picking the ball up, making sure it doesn't happen again. You want to find out what happened and make sure it doesn't happen again. But there's so much blame taking place. Don't point fingers. Don't blame. Just work together to help the day go smoothly. It's changing the way we think. And I worked in public health for many years. I worked in private practice for many years. And sometimes we're set up, especially in the public health situation, where maybe there's not really an incentive to do a good job. Sometimes the people that were making the appointments weren't really scheduling correctly, and so there was extra time. And you might find yourself kind of losing that motivation. That's not a good thing for you either, because you really want to be there doing the best job you can at what you're doing. That gives you the greatest joy. And so it's looking at your job, making it as fulfilling as possible. And as a dentist, taking a look at how you can treat your employees in a way that they feel that they want to come to work with you, that they feel they're appreciated and they're valued. And that's very, very important.
Yeah, I think that's, I'm glad you brought that up. You know, dentists call me because they want more patients, right? They want us to help them bring in more patients and help build their businesses. But I often remind them that, hey, when you see more patients and more patients come into your practice, that usually means more net income for you. However, for your team, it doesn't mean more net income typically, right? People are apprehensive about giving bonuses and what have you. I think that's all. We could have 10 other shows about that. But it's a fact. If you bring an extra, if you bring an extra 50 patients into your practice this month, that's 50 more patients that your entire team is working with, and most of them, probably outside of the hygienist or with excluding the hygienist, are not getting paid for those. So what do you do to motivate your team? What do you do to incentivize them and say, hey, we need more revenue, we need more patients in order to fill our mission? How do you keep your team motivated to want to see those amount of patients?
One of the things that we did, which I'm really a fan of, is for hygiene. The hygienists kind of bring in income on their own. You know, they can be efficient and bring in more income or less income. And so what I am a fan of, at least a partial payment to hygienists, and we would have a base salary, then we'd have a bonus, and the bonus would be based upon what their production was. What we found that by doing that is that we found that the hygienists became more productive, and that there was not much downtime. They scheduled themselves. They would schedule the next patient. And so they tended to schedule themselves in an efficient way. Another thing I found out is that sometimes if you're just paid just a salary for something, and the patient shows up and the patient's 5 minutes late. I mean, how many times, I think most of us have been through it. I practiced for over 30 years. Some hygienists at some point in time can say, oh, he's late, you know, I can't see him. When in reality, you can do most of that work within the time frame that you give it. What we find when you give that hygienist some control over their production, and that they can schedule themselves, and then you give them a bonus when they get more production, when they reach a certain plateau. I found that really helped. We did that it's kind of hard to implement sometimes because many times hygienists were afraid. What we did is we said, okay, we're going to develop this formula, and if you do exactly what you did last year, you'll get exactly the same. If you do better than what you did last year, you're going to make more money. And that really did help. We really found that our hygienists are without us even trying. And I think that one of the wonderful things that can happen in dentistry is if you can get the team to function without you having to put much effort into organizing that or supervising that or micromanaging that, they might say.
Of course.
And so if you can give them incentive to be rewarded, and it might be through money, it might be through appreciation, it might be through a team trip. We would take our team to the American Dental Association meeting every year. And that was a wonderful trip, and it really built the team together because we had a lot of fun experiences there. So we would do things to build the team together, and it worked very well for us. One more thing I would like to say is that team members need, when there is a conflict, they need a way that they can get the conflict solved. And so I would also recommend putting some sort of a conflict management program in place where perhaps you have team mediators that can kind of come in and help resolve some of the conflict between the team members without you having to get involved. Yeah,
that's a awesome thing. So I'm going to ask you one last question for today. So a lot of what we've talked about really kind of points back to leadership, being a great leader. I hear dentists say I'm not a very good leader. I hear a lot of people say that, and it's just not in me. And I personally don't think many people were born great leaders. I think it's things that a skill that somebody learns over time, sometimes really painfully, other times not so much. What is the best book that you think you've ever read on leadership? What is a book that you would recommend to our audience that you've read?
It's a book called The Trust Edge by David Horsager, because the key to good leadership, I believe, is trust. If your team members don't trust you, they're not going to follow you. I think the most important ingredient to good leadership is trust. And so it's a wonderful book. It breaks trust down into 8 pillars, and it helps. As a dentist, I love things that I can just see very clearly. It breaks it down into 8 pillars, and we used it with our team and read the book ourselves. It's absolutely a phenomenal book.
Awesome. Thank you so much for being here, Dr. Harms. Can't wait to have you back. We're gonna jump right onto another episode and record it, but they'll air a little bit apart from one another. But thank you so much for being here. We appreciate you so much.
You're very welcome. It's a privilege to be here.